Life after 60 can be incredibly fulfilling, full of new opportunities, time with loved ones, and enjoying the fruits of your life's work. But as we navigate these years, our bodies sometimes send us signals, little nudges that something might need attention. Some of these signals are easy to understand, maybe a new ache or pain, or needing glasses for reading. Others can feel more personal, more sensitive, even a bit embarrassing to talk about. One area that many men find difficult to discuss, but which is incredibly important for overall health and well-being, is changes in sexual function. It's a reality for many, and ignoring it isn't just about missing out on intimacy. It can sometimes be a warning sign from your body about deeper health issues. Think of it like the check engine light in your car. You wouldn't just put tape over it, would you? You'd want to know what it means. Your body deserves that same attention. There are early signs related to erectile function that many men dismiss, hoping they'll just go away, or thinking it's just a normal part of aging. But a urologist will tell you that paying attention to these early signals is crucial. It's not about doom and gloom, it's about empowerment, about taking control of your health and well-being and potentially uncovering issues that are treatable. In this video, we're going to look at 3 specific early signs of erectile dysfunction, often called ED, that you absolutely should never ignore. Understanding these signs, what they might mean, and why they matter is the first step towards addressing them. Ignoring them can unfortunately lead to missed opportunities for treating both the ED and potentially more serious underlying conditions. It's a sensitive topic, yes, but facing it head-on, with clear information, is the best way forward. These aren't just minor inconveniences. They could be important messages from your body that need your attention. Stick around and watch to the end, because learning about these signs and what to do can offer a surprising amount of peace of mind and open doors to feeling better than you might have thought possible. Let's start with the first sign, something that many men experience occasionally and might initially dismiss as stress or tiredness. This is difficulty achieving an erection that's firm enough for intercourse, or maybe noticing that the firmness isn't consistent from one attempt to the next. It's not necessarily about being unable to get an erection at all, but rather a change in the quality or reliability of erections. Perhaps sometimes it's perfectly fine, and other times, not so much. This inconsistency can be one of the very earliest signals. Think about how an erection happens. It's a complex process involving your brain, hormones, nerves, muscles, and crucially, your blood vessels. Blood flow is absolutely essential. When you become aroused, signals from your brain and nerves cause the blood vessels in your penis to relax, allowing blood to flow in and fill the spongy tissues, making it firm. Anything that disrupts this process, even slightly, can impact firmness. As we get older, our blood vessels can become less elastic, and conditions that affect blood flow, like atherosclerosis, where plaque builds up in arteries, become more common. So if you're noticing that achieving firmness isn't as easy or reliable as it used to be, even if it's only sometimes, this isn't just an isolated issue with sexual function. It could be a gentle or not so gentle reminder that your vascular health needs a checkup. This is why urologists stress never ignoring this early sign. ED, especially when it involves issues with firmness and consistency, is often one of the earliest indicators of underlying cardiovascular problems like high blood pressure, high cholesterol, or even early-stage heart disease. The arteries that supply blood to the penis are smaller than the arteries leading to the heart or brain. Because they're smaller, they're often the first to show damage from plaque buildup or narrowing. So, difficulty with firmness can be a warning sign for your heart and brain health years before you might experience chest pain or other symptoms of heart disease. It's like a canary in the coal mine for your circulatory system. Ignoring this sign and thinking it's just about aging or performance pressure means potentially missing a critical window to address these cardiovascular risks. Imagine if you knew your car's engine was showing an early warning, allowing you to fix a minor issue before it caused a major breakdown. Your health is far more valuable. When you see a doctor about this specific sign, they won't just focus on the ED itself. They'll likely want to check your blood pressure, cholesterol levels, and blood sugar. They might ask about your lifestyle habits, your diet, exercise, smoking status, and alcohol intake. All factors that significantly impact cardiovascular health and, consequently, erectile function. Understanding the link between this early sign of reduced firmness and overall vascular health is key. It reframes the issue from just being about sex to being about your fundamental physical well-being. It's a call to action to get a health checkup, to discuss your risk factors for heart disease and stroke with your doctor. They might recommend lifestyle changes, like adopting a healthier diet, getting more physical activity, managing stress, or quitting smoking, all of which can improve both your heart health and your erectile function. They might also suggest medication for blood pressure or cholesterol if needed. Sometimes, specific medications you're already taking for other conditions might be contributing to ED. Your doctor can review your medications and make adjustments if possible. The point is, this early sign of inconsistent or reduced firmness isn't something to feel ashamed of or to hide away. It's valuable information your body is giving you. By acknowledging it and seeking medical advice, you're not just taking a step towards improving your sexual health, you're potentially taking a crucial step towards preventing a heart attack or stroke down the line. It's a proactive measure for your long-term health. So, if you've noticed that things aren't quite as reliably firm as they used to be, please don't brush it aside. See it as an important signal. A conversation with your doctor is confidential and essential. They've heard it all before, and they are there to help you. Discussing this specific change allows them to investigate potential underlying causes, particularly those related to your cardiovascular system. It's about addressing the root cause, not just the symptom. Taking action based on this early sign can lead to significant improvements in both your quality of life and your overall health outlook. It truly is a sign that should never be ignored because of its potential connection to more serious, yet often manageable health conditions. Now that we've talked about the importance of noticing changes in the firmness and consistency of erections as a potential signal for cardiovascular health, let's move on to another early sign that many men might overlook or attribute to simple aging. This second sign is noticing that erections, when they do occur, don't last as long as they used to. It's about the duration of the erection, whether it remains firm enough for satisfying sexual activity for the desired length of time. Perhaps achieving firmness is still possible, but maintaining it throughout intercourse becomes a challenge. This specific issue, the inability to sustain an erection, can point towards different underlying factors compared to the difficulty in achieving firmness initially, although there can certainly be overlap. One significant potential cause linked to this issue is nerve damage. Over time, high blood sugar levels can damage nerves throughout the body, including the delicate nerves involved in sexual function. This nerve damage, known as neuropathy, can interfere with the signals needed to keep blood trapped within the penis, leading to the erection fading sooner than desired. So, if you're experiencing this issue with duration, especially if you have risk factors for diabetes like being overweight, having a family history, or experiencing increased thirst or urination, it's a strong signal that your blood sugar levels need to be checked. Undiagnosed or poorly managed diabetes is a major contributor to ED, and the inability to sustain an erection is a classic symptom associated with the nerve and vascular damage it can cause. But it's not just diabetes. Other conditions affecting nerve function, though less common, could also be at play, such as multiple sclerosis or even certain vitamin deficiencies impacting nerve health. While nerve damage is a significant physical cause for erections not lasting, psychological factors can also contribute, and often these two are intertwined. Performance anxiety, stress, depression, or relationship issues can absolutely impact sexual function. Sometimes, the anxiety about losing an erection can become a self-fulfilling prophecy, making it even harder to maintain firmness. However, when an erection simply fades without conscious effort or major distraction, especially if it happens frequently, it's more likely to have a physical component, potentially involving nerve or vascular issues. Another less common but possible physical explanation for erections not lasting is something called venous leak. Normally, once blood flows into the penis to create an erection, valves within the veins constrict, trapping the blood there to maintain firmness. If these valves don't function properly, blood can leak out too quickly, preventing the erection from being sustained. Venous leak can be related to aging, certain medical conditions, or even prior injury. While less directly linked to systemic health issues like the vascular problems causing initial firmness issues, venous leak is still a physical problem requiring diagnosis and potentially different treatment approaches. The key takeaway here is that the inability to sustain an erection is not just a matter of losing interest or simply getting older in a benign way. It's a specific change in function that warrants investigation. Just like with the firmness issue, bringing this up with your doctor is vital. They can assess your symptoms, ask targeted questions about when and how this occurs, and perform necessary tests. Checking for diabetes is crucial if you're experiencing this. They might also consider nerve function tests or even specialized vascular tests if necessary, although these are usually done after initial checks. Addressing this sign isn't just about improving sexual performance, it's about potentially diagnosing and managing conditions like diabetes early, which has profound positive impacts on your overall health and prevents complications in other parts of your body, like your eyes, kidneys, and feet. It also opens the door to discussing the psychological aspects, if present, with a healthcare professional who can guide you towards resources like counseling or sex therapy if needed. Sometimes, simply knowing the physical cause can alleviate a lot of the anxiety, which in turn can help improve function. Ignoring the sign that erections don't last means potentially allowing conditions like diabetes to go unchecked, leading to more severe health problems down the road. It means accepting a limitation that might be treatable. Modern medicine offers various options for managing ED, depending on the cause, from lifestyle changes and medications to other therapies. But the first step is understanding why it's happening. That understanding comes from discussing this specific sign, erections not lasting, with your doctor. It's a distinct signal that needs to be heard, understood, and acted upon for your continued health and well-being. Moving on to the third significant early sign of erectile dysfunction that you should never ignore. This one relates to something often considered a sign of healthy erectile function: morning erections. Many men, particularly younger men, experience spontaneous erections upon waking up, often unrelated to any sexual thoughts or stimulation. These are typically a sign that the nervous and circulatory systems involved in erection are functioning well, particularly during REM sleep cycles. While the frequency of morning erections can naturally decrease somewhat with age, a noticeable and persistent absence or significant reduction in morning erections, especially if you used to have them regularly, can be an important signal. Why is this sign particularly significant? Because morning erections are often involuntary and not typically linked to immediate sexual arousal or psychological factors like performance anxiety. Their presence usually indicates that the physical mechanisms required for erection, healthy nerves and sufficient blood flow, are largely intact. Conversely, their absence or significant reduction often points more strongly towards a physical cause for ED rather than purely psychological factors. If you're struggling to get erections at other times, but still experience regular morning erections, it might suggest that performance anxiety or other psychological issues are playing a larger role. However, if you're also noticing difficulty achieving or maintaining erections at other times, and you've simultaneously lost or seen a significant decrease in morning erections, this combination strongly suggests an underlying physical issue is the primary driver of the ED. This physical cause could be related to the vascular problems we discussed earlier, nerve issues, hormonal imbalances, or side effects from medications. Hormonal changes, specifically a drop in testosterone levels, can sometimes contribute to ED and also impact morning erections, though low testosterone isn't as common a primary cause of ED as vascular issues are, especially in older men. However, if you notice a lack of morning erections alongside other symptoms like fatigue, decreased muscle mass, or low libido, it's worth having your hormone levels checked. Medication side effects are another possible culprit when morning erections disappear. Many common medications prescribed for conditions prevalent in older adults, such as blood pressure medications, antidepressants, and even some over-the-counter drugs, can affect erectile function. If you've started a new medication around the time you notice the decrease in morning erections, discussing this with your doctor is essential. They may be able to adjust the dose or switch you to a different medication. The absence of morning erections, especially when combined with other difficulties with achieving or maintaining erections, serves as a valuable piece of diagnostic information for your doctor. It helps them determine whether the issue is primarily physical or potentially more rooted in psychological factors. While psychological factors can certainly contribute to ED, particularly performance anxiety, which can create a vicious cycle, a persistent lack of morning erections steers the investigation more firmly towards physiological causes that need to be identified and treated. Ignoring this specific sign means potentially missing a key indicator of a physical problem that requires medical attention. It reinforces the pattern of hoping the issue will just go away, rather than seeking diagnosis and treatment for what could be a very treatable condition, or worse, an early symptom of a more serious underlying health issue. Paying attention to your body's signals, including something like the presence or absence of morning erections, is part of proactive health management. It provides valuable clues that can guide your doctor towards the most effective diagnosis and treatment plan. So, to reiterate, the 3 early signs of erectile dysfunction that you should never ignore are difficulty achieving an erection firm enough for intercourse consistently, erections that don't last as long as they used to, and a significant reduction or absence of morning erections. Noticing any of these is not a cause for panic, but it is a clear signal that warrants a conversation with your doctor or a urologist. These signs are often interconnected with your overall health, particularly cardiovascular health, nerve function, and hormonal balance. ED itself is very common, affecting millions of men, and it's highly treatable. There are numerous effective treatments available, from lifestyle modifications, oral medications, vacuum devices, injections, and even surgical options in some cases. The right treatment depends entirely on the underlying cause, which is why getting a proper diagnosis is so important. Addressing ED is not just about restoring sexual function. It's about improving your quality of life, your confidence, and your intimate relationships. Perhaps even more significantly, addressing these early signs can lead to the diagnosis and management of serious health conditions like heart disease or diabetes, potentially adding years to your life and improving your health in countless ways. Remember, you don't have to live with ED or ignore these signals. Speaking openly with a healthcare professional is the first and most crucial step. They are there to help you navigate this sensitive issue with respect and confidentiality. Don't let embarrassment or fear hold you back from seeking the help you need and deserve. Your health and well-being are paramount. Taking action based on these early signs is an investment in your future, allowing you to live your best life with confidence and vitality at every age. If you found this information helpful, please give this video a like. It helps us know we're providing content that matters to you. Also, share your thoughts or experiences in the comments below. Connecting with others facing similar issues can be incredibly supportive. And please, subscribe to our channel for more videos dedicated to helping you navigate health and life after 60 with knowledge and confidence. Remember, taking care of yourself, including addressing sensitive issues like ED, is a sign of strength. Live your best life at every age.